Assalamu alaikum, sir.
Assalamualaikum ji, Fahad sir.
Assalamu alaikum. We are very glad to have Taimur Malik with us, who will be talking us through the importance of technology in the wake of the corona epidemic globally and in the context of Pakistan as well. So thank you so much, sir, for joining us. Um, and Taimur Malik Saab has been part of the PIDE response working group, who have been working around the clock to create awareness and to produce material which is being published on a daily basis. So my first question to you would be, it's kind of a generic question, but I think it's a good way to seep into this whole debate, that what is the use or the efficient use of technology in the wake of the corona epidemic globally? And the part B of that question would be that how responsive or innovative the technology is in the context of Pakistan.
Bilkul ji, Fahad sir. Thank you very much for having me here. It's been a real pleasure to work with PIDE over the past week. The people on this task force have certainly been working 24/7 to come up with great ideas. It's really been a very great learning experience for me as well, to be sitting amongst great intellectual giants like Dr. Nadeem ul Haq, Dr. Shahid Kardar, Dr. Sami Altaf, who's a public health specialist. So it's been a great learning experience for me as well on the tech side as to how we can respond to the COVID-19 efforts. Going to your question, G, it's almost a bit of a cliche, but they say that data is the new oil. And there's a lot of talk these days about data-driven policy making and kind of data-driven decision making and evidence-based decision making. And technology has become such a big part of our lives that I don't think anything that we used to do cannot be done better today using technology. The COVID-19 response globally has brought up a lot of new and innovative tech solutions across the world. The South Korea example is widely touted amongst the press, and a lot of what they did was, of course, very policy-based as well. But perhaps a lot of those policies would not have been possible to implement without robust and advanced technologies. So to give you a very basic example of where technology can come in, of course, we have a large country, we have a large population of 200+ million people. And in the context of understanding where the cases are, how the contagion spread is spreading across the country, understanding in a central location how many cases are emerging on a daily basis, doing analysis based on that. And perhaps most importantly, depending on the policy that the government decides to take in the coming weeks and months, the ability perhaps to effect selective lockdowns based on where the contagion is spreading. I think that is where technology will really have a critical role in helping the government both decide its response based on the data that's coming in, and as a next step also to coordinate response amongst the vast group of volunteers that the government has very rightly chosen to engage as part of its response efforts. So there was a part B to the question, if you can kindly remind me of that.
Yeah, so you talked about the South Korean model, and there has been a lot of debate in the public and political discourses as well as in the academic discourses as to what we can learn through that model. Do you think, and one of the important alternative narratives to that is that the governance structure in Pakistan or in South Asian countries for that matter is not as strong to give it a strong footing to that model. Do you agree to that, or do you find any commonalities which can be drawn in the context of Pakistan, or can it be workable or implementable in a country like Pakistan as far as technology is concerned?
Gee, that's an excellent question. Technology is a great leveler in many ways. Technology, especially in a place like Pakistan, we have such a talented resource pool. We have great entrepreneurial spirit. We have great technology and IT skills. And I think that gives us a bit of an advantage compared to maybe some other countries that are still developing but don't have that great resource pool and that depth in their IT talent. The South Korea model is really very interesting because one of the topics I'd really like to discuss today is kind of the tussle between your civil liberties on the one hand, and on the other hand, the great kind of strength and the great power in being able to trace individual citizens with respect to where they're going, who they may have contacted, and where the spread may have gone further because of them. I've been having these debates, as a lot of us have been, with our friends, with our colleagues, with our mentors. And in many ways, I feel like in a place like Pakistan, where there's a bit more of an understanding, at least historically, of civil liberties being perhaps not as strong as they are in more robust Western democracies. Of course, one has to be both more careful at a time like that, in a situation like that, where civil liberties are already perhaps not quite as strong. But personally, I have I have rather utopian views when it comes to technology. So one of the things, if we do go on that South Korea model, which is not entirely insurmountable, the technology itself is not expensive. There are challenges with respect to bridging the digital divide, but again, those are not insurmountable challenges. The question might be, and this is something that I think our government should look at, if they go ahead with that kind of model, what kind of data privacy laws would they enact? What kind of guarantees would they give to the citizenry at large as to how the data will be used? And more than that, I'm looking at obviously it's a major crisis, but every crisis perhaps has a silver lining as well. I'm looking at the technology that might emanate from this crisis as an opportunity for initiatives like Digital Pakistan to perhaps plow ahead with a lot of initiatives they would have taken that can now be easier because there's a lot of focus on the technology aspects. I'm looking at this as a potential opportunity for us to come up with more robust data privacy laws. I was looking at the Punjab government's data privacy laws, but I'm not sure at this point whether the federal government has any real robust framework by which to address these things. But to go back to the question, the South Korea model, I do see it being workable here. One of the key things that was implemented there was contact tracing. There are very, very robust solutions available for that. I would be remiss if I weren't to mention my own company, SAP. There are many other companies out there doing very similar things, but even I have more perhaps knowledge about our own solutions. I'm working with our local team and a regional team to refine these solutions and propose them to governments. These tools are easy to deploy. They're not expensive. In some cases, SAP has made some very critical tools available for free as part of our contribution to the world around us. I don't think these things are insurmountable. I think with the right coordinated effort, with the right protection, as we discussed about civil liberties, these things can certainly be implemented.
Okay, thank you so much. Another very important thing which is being discussed these days, and I think the debate will be more aggrandized in the coming days as well. It is about how to increase the number of quarantines, or the number of ventilators, or the number of face masks, or the human resource, or the physical infrastructure, or all the materials which are being used to cater to the epidemic. So how do you view that in a country like Pakistan, where there is always but particular to this context, if we contextualize this issue, if you can contextualize the whole thing to this particular issue of epidemic of coronavirus, so how can technology be used to increase the availability of the medical equipment and the uniforms and the face masks and the ventilators in particular? How can that be tapped into, because that is one of the important concerns right now?
Absolutely. No, and that's a very important concern. Especially when our doctors right now are our frontline warriors, and if we aren't able to protect them, then only God can save us, I would say. There's multiple dimensions to that question. The ventilators themselves, that is a technology that was perhaps invented many years ago. Let's talk about, for example, the supply chain of these particular products, the PPE products and the hospitalization products. That would be very critical here. We're quarantined in the physical world,
Yes.
But the internet has allowed us to kind of have freedom, kind of a virtual freedom. At the virtual level, we all exist and we're not quarantined there. And supply chains are still very much active. We have access to global marketplaces. Again, I don't want to make this too much about SAP, but one of the products that we're offering for free to governments is a global network of buyers and suppliers who can, within a couple of clicks, be connected to one another, post their requirements, and be connected to suppliers who are able to logistically deliver items to Pakistan. Technology can also be used to make supply chains more efficient, to make manufacturing more efficient, to better connect places where the need is higher to where the supply chain is coming from. So, again, as we said, as we discussed earlier, technology has so far permeated into our existence that anything that we do that we used to do in a traditional way can now be done better, more efficiently through technology. With respect to ventilators, I mean, I'm by no means a public health specialist, and I hope I'm not too wrong about this. But one of the debates that I'm seeing that I think is a very important debate that needs to be perhaps broadened into the discourse is whether we have the capacity to operate ventilators. Now, again, technology can have a role there. I mean, we have a huge explosion of free tools, YouTube being one of them. There's no reason why the government can't leverage a tool like YouTube to have learning modules which they can share with our medical staff to better understand how to operate these ventilators as well. So, technology, once again, anything that I think we would do in the traditional world can only be better done through the technologies that we have today at our disposal.
Okay, so if we contextualize it in the context of Pakistan, then of course, I guess, or the debates that have been generating for quite some time, right, till now, the supply side is slowly and gradually becoming more of a sensitive. But what about the demand side? Because that is related to human behavior and human interactions and social distancing. In a country like Pakistan, it's so very difficult to convince people. For example, when we talk about mass prayers and congregational prayers, they are still part of the concern for debates. So how to sensitize the demand side and how to pulse that and to create awareness about that through the use of technology. I think the governments and the provincial governments are doing their bit by creating different forms of apps to create awareness about it and to make this debate not just part of the political and academic discourses, but of the public discourses as well. So what do you think can be the effective way for the government to lay out or to frame that way out for the people to sensitize more of the demand side?
Ji, bilkul, and that's a very important question, Fahad Saab. So again, we already touched on digital media tools like YouTube, for instance. There are many other ways using digital technologies to reach the masses. In fact, perhaps without these digital tools, it would not have been possible to disseminate the correct information the way that it needs to be done. I want to touch, before I forget, you mentioned our congregation in terms of Friday prayers, for instance. Just last night, I was looking at a global website that's being operated. I actually don't know who's running it, but it's a wonderful initiative. It's an organization that's coordinating different technology interventions, getting volunteers involved, getting developers involved. I think I have it written down somewhere. It's called helpwithcovid.com. I saw a very, very interesting app idea there. Somebody had mentioned that his parents are very keen churchgoers, and he wanted to develop an app which would allow, for example, the church to continue running but from a remote kind of location. So, for instance, you could have your church get your hymns with me. Your pastor could be there and deliver his speech. And I was trying to think about how we can make that work in Pakistan as well. जो हमारे जुमा के खुतबे होते हैं, there's no reason why a Maulvi or your village kind of your Qari Sahib, whoever is leading the Friday prayers, there's no reason why he cannot deliver his khutbah online. There's no reason why we cannot feel the sense of community using technology, just like the tool we're using right now, like Zoom, to have kind of congregational prayers in a virtual environment. So, there are lots of things that we can do. Just a small anecdote, after this social distancing, I have a very active social life, but I'm not meeting my hands. But it's so much, in many ways, it's so much more fun to use tools like Zoom, tools like Skype, tools like Microsoft Teams. We all get together, at 10:30, 11 p.m. We discuss the daily events. And I'm seeing people that perhaps I would not have seen in a physical way in real life, but I'm now reconnecting with them using these kinds of tools. So I think slowly but surely we will see a proliferation of these kinds of technologies. I do think we'll see a lot of adoption. The challenges perhaps will come in when it comes to things like bandwidth, when it comes to the ability of these tools to handle the manifold increase in traffic. And I think that's where our government at the policy side needs to begin to think about what they can do to ensure that there's business continuity, for instance, to ensure that people who are quarantined are able to feel connected with one another, because of course there's a massive psychological aspect that is seeing some kind of mention in the international press, but in Pakistan, where mental health is not considered a major concern, there's not enough kind of discourse or debate over here about that as well. So I think these kinds of tools will really find new meaning for us in our lives, help us collaborate, help us feel a part of a community which traditionally we used to obviously interact person to person, but not so much anymore. With respect to the digital media and the dissemination of information, that's a very, very interesting and perhaps multi-layered topic as well. So, I won't bore you with things that I'm sure you know better than me, your YouTubes and your Zooms and your Skypes and your Teams, as to what kinds of digital media channels exist for the dissemination of information. But I think the government once again has to take a multi-pronged approach here. There's no reason, we have COVID-19.org.pk running. It's a fairly well-run website. I think there needs to be a national debate, but a very quick national debate as to what kind of transparency government wishes to bring. Again, this is a transformative event, in my opinion, and technology will have a major role to play here. I think it's time to begin to think about how governments can be more transparent. I think the benefits of transparency to the public with respect to dealing with the COVID-19 response are self-evident. And I think it's a great idea and a great time for the government to begin to become more and more open. We have some excellent initiatives, the open data initiatives, which are designed for government. There are so many great protocols designed for governments to be more transparent. And there's a lot of good research as to how it builds trust amongst the public. I think at a time like this, where people are feeling more and more disconnected, it's a great opportunity for government to almost reorganize and transform itself and the way it interacts with the citizen. And I think through these transparency tools, through dissemination of information, that's a great way to connect. One thing, Fahad, that I'd really like to point out is, I find cognitive biases to be very interesting as a topic to study. And anchor bias, which is basically, the tendency that we all have as human beings to accept the first piece of information we get about a new subject, and then not as easily accept new pieces of information that come on top of that. So I think it's very important, because this is a rapidly evolving threat. I think it's very important for governments to have a mechanism whereby they can keep abreast of new information that's coming in, if they need to kind of modify their strategies and their policies accordingly. So I was very disturbed to see, about a week or a week and a half ago, a very senior government functionary was on TV, recorded as saying, Kiji, if you drink warm water, then your chance of contracting the virus go down significantly. I think, without any prejudice to the right to speak freely, I think the government needs to have a policy by which it controls the message, so that we can kind of counter what's called the infodemic as well. There's a lot of fake news going around, and I think the government needs to have a mechanism not just to make sure that it's keeping abreast of any new developments, but also more importantly that it's able to control the message, issue its stamp of approval. And there's no better method than using digital tools to do this as well.
Okay. Thank you so much, sir, for your time. Thank you so much. I think we all live in hope, and I hope we all sail through and live through and survive through these more difficult times. Thank you.
Absolutely, Ji, and your efforts at PIDE, I think, are very important for this as well. Thank you, Fahad.
Thank you so much, sir. Thank you.